Edward Amory Winslow defined public health as the science and art of preventing disease, prolonging life, promoting physical health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, the education of the individual principles of personal hygiene, the organization of medical and nursing service for the early diagnosis and preventive treatment of disease, the, the development of social machinery which will ensure to every individual in the community standard of living adequate for the maintenance of health. Winslow believed that the field of public health is dynamic and a social science. According to him, public health was not just a control of infectious or communicable diseases, a view which was predominant during his time. In fact, public health is associated with environmental sanitation because it is linked to due to biological link between unsanitary living conditions and practices with diseases. Wait, check lang siya. Sulod siya ko. Me. Okay, Winslow also believed that public health is also concerned with the prevention of development of non-infectious disease or lifestyle-related diseases, including mental disorders and diseases associated with poverty. Based from Winslow definition, public health deals with the following. Excuse me. Number one, it deals with the surveillance of emergence of diseases, identification of diseases among community members, investigating factors that contribute to the existence of diseases, educating the community regarding ways that will prevent them from acquiring the diseases, creation of strategies that will ensure sustained well-being among the community, provision of health services to address community members who are already having the disease or recuperating from complications of the disease, institutionalize lessons learned through policies and structures that will prevent occurrence of similar or other diseases. And the last one, monitoring the health status of the community and providing providing means that will ensure them of sustaining their health and well-being. Okay. Being a subset of public health, community health is the study and improvement of the health characteristics of community. Community health deals with the processes that enable communities to maintain and sustain their health and well-being. Dealing with the community health means dealing with both the supply side and the demand side. Lang ato sa admit ano. Okay, again, dealing with community health means dealing with both the supply side and the demand sides. Okay, if there are patients no in the health centers, sa mga hospitals, if daghan na kayo pasyente, and that's the time that we also demand no for medical supplies, mga healthcare professionals to accommodate them, and accessibility of health services, no? And of course, mga healthcare professionals or health service providers. Former Canadian Minister of National Health and Welfare Mark Lalonde proposed in his working document a new perspective on health of Canadians. a health field concept, which is a framework in analyzing problems in public health field. Sorry. There, there are four broad elements of health field. Number one, we have human biology. Lalonde described this element as aspects of health, both physical and mental, which are developed within the human body as a consequence of the basic biology of men and the organic makeup of the individual. Okay, like for example, if if your parents are hypertensive, so genetically imo siyang mamana, no? And then of course when you get old siguro, then certain diseases will develop, no? You will become hypertensive. Number two, environment. Those matters related. Okay. Example. Okay, number two, we have environment as one of the broad elements of health field. Lalonde described this element as those matters related to health which are external to the human body and over which the individual has little or no control. Okay? Like, for example, poor water and air quality can increase the risk of those exposed to them of developing certain type of diseases. Okay, if your living condition, no, if you're living in a place where it is crowded, also, no, and and your house is built with poor housing materials, it may be hazardous also to health, no. It can, and if the environment is marag squat area siguro, or the environment dili siya limpyo, no, it may increase or it can increase the spread of communicable diseases. Or kung ang materials nimo gigamit sa balay dili kay tarong, no, it may increase injuries pod. So that's it. We have lifestyle, an aggregation of decisions by individuals which affect their health and over which they more or less have control. So you as a person or individual, as an individual has all the rights, no, to decide on your own whether if you want to smoke or if you continue to smoke or to stop to smoke, no, or pwede gapon na if you want to drink, then I can drink. So it's actually a decision. Okay, the last one we have healthcare organization. Lalonde lamented that most of the society's efforts in improving health have been focused solely, if not most of the time, on this fourth element. Healthcare organization consists of quantity, quality, arrangement, nature, and relationships of people and resources in the provision of healthcare. And healthcare organization is synonymous to healthcare system. Okay, so now let's move on to levels of healthcare. There are three levels of healthcare. We have primary, you have secondary, you also have tertiary care. No? Primary care refers to activities or services provided by healthcare professional acting as a first contact or consultations of for all patients within a healthcare system. Okay. Anyway, a person who feels like he is sick, no, siya gid ang maka-judge ang kagalingon if he really or she wanted to go to the nearest health center. Okay? Or ang first treatment or first aid treatment, no, to that illness or sickness nga nasa balay, it actually begins at home. Mo gyapon na siyang primary care, no? Pag if there is lacking or missing sa pag-care niya sa tao, no? In terms of treating the illness, no? Then that is what we call the first delay. So a delay in seeking care to patient's condition at home. Okay? Pag di na makaya sa primary care, no? In health clinics or maternal clinics or health center, then that's the time that the doctor or the nurse will refer the patient or the person to the hospital from which the patient can actually access um, health services na advanced pa, no? And that's what we call referral process. Referral process is a process by which the patient is transferred from one level of point of care to another. Begins at home where the patient experiences form of illness. Referral process also applies to secondary, no? Secondary to tertiary. Pwede gapon primary to tertiary. As long as naa siya referral gikan sa nurse or sa doctor. Okay? What is secondary care? Okay, secondary care is usually provided by medical specialists and other medical professionals to whom a primary care professional has referred to. It is associated with hospital-based care through not all secondary physicians are practicing in the hospital setting. So dili tanan kompleto except for anti-psych o not anti-psych but those psychiatrists, no? A psychiatrist and oncologist, no? Okay, kani mga psychiatrists and oncologists are actually specialized field of practice of medicine, which is makita nato siya sa tertiary care for a while, ha. Hapit naman po ang last naman eh. Usually, cases referred to secondary care level have been filtered out by the primary care health professionals, and cases referred at this level usually require a more specialized type of service. Unlike primary care, secondary care is more focused in its form of service and type of patients. Since sa primary care, there's a time nga murag check pa ka sa diagnosis sa pasyente sa problema, ano? But here, you already in secondary care, no, you already determined, and I mean the sickness and the illness already identified. No, the types of service provided are more complex in nature than the ones being provided for at the primary level. Okay, tertiary care. Okay, guys, sa secondary delay, same gapon, resulting to delay in the transport of the patient from one health facility to the higher level of care. Dili na sa balay, kung dili sa hospital, or from the health center to the hospital. If there's a lacking of, if there is a delay, no, in the transport of the patient from one point of healthcare facility to the higher level of care, it could either be hospital or more advanced hospital, and that is second delay. Okay, then we have the tertiary. This is more specialized form of healthcare. It's more advanced state-of-the-art facilities na siya, no? And again, services are more advanced. So services are far more advanced considering that the medical cases referred to this level are far more complex. The number of patients being catered at this level are fewer than those compared with primary and secondary care. Because medical cases are more difficult, diagnostic procedures are more complicated and advanced. Cancer management usually falls at this category. More advanced surgical procedures, such as neurosurgeries, also fall under this care or category. Okay, again, the process by which a patient is transferred from one level or point of care to another is called referral process. For a while, guys. Wait lang, guys. Okay, sorry. Okay, continue. This is the last. We have the third delay. No, we're done with the second delay and the third delay. It usually happens sa mga tertiary hospital, no, or who tertiary hospital due to unavailability of medical specialists siguro and inadequate medical supplies, no, na kinahanglan sa procedure, or maybe equipments and supplies, or due to overwhelming congestion of patients seeking care, a patient may not be able to receive urgent and appropriate care. This delay in the provision of healthcare to the patient is also referred to the third delay. Okay? Once the patient is already healed, guys, or treated and fully recovered, to ensure nga naayon ng pasyente, no, is already or she is already treated, and there is a continuum of healthcare provision na needed by the patient to fully recover from his or her illness. This process is what we call the return referral process, no? If the patient gets home na, tapos para masigurado nga continue gyapon ang recovery and treatment, then that's the time na mo at balik gyapon siya sa iyahang facility or the doctor in charge sa iya. So that is what we call the return referral process. Okay? This one. Sorry. Return referral process. Okay, so that ends the chapter. That ends our topic for coverage for the prelim exam in this chapter 1, no? Introduction to health. So ang mga coverage exam is definition of health, the community development, health fields. You have level of healthcare and referral process, and different delays and levels of healthcare. Yeah. Okay. Guys, actually, I already have the schedule for the exam. But, dili pa mi allowed nga i-divulge lang information about the exam. Doon na ang schedule sa exam kay base dag malibog kay murag alos na naa sa parking area. Okay, so the exam will start on the 12th and will end on the 17th. So tomorrow we don't have class. It's holiday. It's Chinese New Year. Okay. So any question? Hello? Chavez, Silvano, you're good, guys?
Yes, sir. No question so far.
Okay. Kasi nangatulog na mo. Boring din yung klase. Tulog na ni si ano. Okay, we're good. Guys, nagpapirma na mo sa inyong clearance sa Sigma. Apil ba mo, di ba? Tanan man, di ba dapat mag-contribute? Yeah, actually si June Rose naa sa main karon, no? You can actually have your clearance signed by her or Ma'am Louise or sa KUA, no? As long as you already paid the contribution fee, no? For our foundation day. Okay? So any question wala na regarding the exam, unsa man wala na? Wala na? Okay. Thank you for joining the class. I still have to go to main campus. So thank you and see you next week for your exam and good luck guys. Thank you. Multiple choice. Dili multiple choice. Wala pa tayong multiple choice. Mostly it's essay, no? And fill in the blanks. Usually essay magaling public health. Okay? And then I'm going to send you the word the image slides, no? But okay, summarize hand out, no? Wala mo guna ko na PowerPoint kay di lagi mo di siya compatible guys. Wala pa gyud na akong isa ka laptop and then they're still looking for the charger and they order the charger outside the country. So that's it. Anyway, thank you so much. Okay. Uh, Introduction to Public Health, first edition, that's 2015 by Bien Eli Nilios. For a while, ha? Anyway, sad ba na ako kung ang katong akong gimo sa word, no? Introduction to Public Health, first edition, 2015 by Bien Eli Nilios. Ano siya guys? Kita ninyo? Wala siyang reference na to, ano? Introduction to Public Health, first edition, 2015, Bien Eli Nilios. Okay. Guys, remember mo sa oral na quiz? No? Kato siya sa finals na to siya nakaibutang tanan, no? And then, we have also a part quiz gapon sa exam. So, mga 20 items or 30. So kato siya. Okay, thank you so much for joining the class today and good luck for next week. Bye-bye. Thank you.